Hello and welcome to another edition of Know Your Schools on WISD TV. My name is Dale Caffey. I am pleased to have as my special guest today Heather Branch, the Coordinator of Student Health Services at Waco ISD. Heather, thank you so much for taking time out of your day to join us. Talk to me about your role at Waco ISD, Coordinator of Student Health Services.
Yes.
I know that's quite a bit of responsibility, but if you could talk about some of that.
Yes, I am the health coordinator for the district. I have been a nurse for 8 years now. I started about 6 months ago with the district and have really enjoyed coming here. I'm over the 22 nurses for the district, and so we handle policies, procedures, and guidelines and implement best practices for our students to get good care for our children. We also work with outside sources to make sure that they have the financial and means of taking care of themselves health-wise as well. And so I make sure that children have their immunizations for the first day of school. And I also just make sure that we're giving good holistic care in our nursing clinics. Let's talk about, before we talk about your role as a Waco ISD employee, your background in nursing. Yes. You've had quite an experience. I have. I started my career off in emergency medicine as an LVN. I went on to get my registered nurse degree, and I went on to work in the ICU at Providence, and then my last job was in the emergency room with trauma. As a floor nurse, doing as a trauma nurse as well as an assistant manager of the emergency room. You have seen a lot of things then. Yes, a lot of emergencies.
Right. I know that can be a hectic time. What made you decide to join Waco ISD?
I got a really big passion for community health and emergency preparedness after the West explosion. I was in the emergency room during that time. I saw patients come in, and I saw some of the struggles that they had rebuilding and some of the public health awareness that we needed to come together as a community to help with these resources. And I really enjoyed that. And so when this position came open, I thought, what a better way to get to those frontline children, the kids that I see every day in the emergency room with financial struggles or just education, needing to educate them about their health. I really wanted to make a difference in the children's lives, and I thought, what better way of being responsible for all of them of Waco.
Talk to me a little bit about the people that work for you, those campus nurses.
Yes.
And the care that they have for those children.
They all have a very distinct background in nursing. I have a few that have their bachelors. There are 5 registered nurses, 13 LVNs, and 3 of them are CMAs, which is medical assistants and nursing assistants. Mm-hmm. Our bigger campuses, high schools, have registered nurses to help implement plans of care plans, health plans, things of that nature. And then our LVNs do basic nursing care and assess our children and make sure they don't need to be referred to someone else.
Okay, we're going to talk about some of the responsibilities that those nurses have in just a moment, but also responsibility that you and they have is immunizations.
Yes.
And that is a big subject for this time of year as we go into the new school year.
Yes.
Let's talk immunizations and what the law says and what's required.
The Texas Education Code states that no child is to enter an elementary school or a secondary school without being vaccinated against measles, mumps, rubella, chicken pox, things of those nature, vaccine preventable diseases. We want to keep our children safe, and we want to keep the children at home safe. So getting your children immunized is very important. It keeps us safe, it keeps them healthy, and it keeps them in the classroom.
Very good. So what will happen on the first day of school if we have a child that comes in and the nurse says, I'm sorry, but you're not current on your immunizations? Correct.
In the past, we haven't necessarily enforced that rule 100%. This year, we're enforcing no shots, no school. So the first day of school, if the child comes in and they're not current on their immunizations, then we will send them to either the health department or their primary care doctor, family health center. There are a lot of places that offer immunization clinics that the children can get their up-to-date shots.
Very good. So parents, it's important to know there is no 30-day grace period this year.
Correct.
I believe last year we practiced a 30-day grace period to get them current. Not doing that this year.
Right. And we are really enforcing and get in with your doctors fast. They have to make sure that there are enough immunizations for all the children. So if you wait to the last week of school or before school starts, it's probably going to be too late to get in there and get into your doctor. So it's important to go ahead and make your appointments now to get in with your primary care doctor.
And of course, we know that immunizations keep children from getting sick many times.
Yes.
And of course, that means staying in the classroom.
Yes.
And that's where the nurse comes in on the campus also.
Yes.
Whether it's a cut finger or a headache or something, nausea or anything that's bothering the child. Talk to me about what that school nurse is charged to do.
We really look at keeping the kids in the classroom. If it's minor things that we can handle, temperatures, out of hand, children vomiting, things like that to that nature where they are too sick for school, then that's when we intervene with the parents. And what we really want to do as much as we can and give the kids good health at school so they can actually stay in the classroom.
And it's important for parents to note too is if a child is on a prescription,
yes,
that they need to go through the nurse,
yes.
right?
When you register your child before school starts, bring in those medications with the doctor's orders and bring them to your nurse. Describe what time they need to take those medications, how often, and what are some of the side effects that your child may have. When you want to be called for illnesses, when you don't want to be called for illnesses, and just form a good relationship with your nurse because that's who's going to care for your child from the time you drop them off till you see them again when they get home. And so we try to do a really good job at teaching the kids on what's wrong with them, why are they taking this medicine, and being compliant and coming to the nurse's office every day and maintaining good health for them.
Very good. Anything else that I'm forgetting to ask you about your role in the district?
I'm also the lead, coordinator for the Student Health Advisory Council, which is our SHAC.
Right.
So we are looking for parents who are also involved in the PTA, who are passionate about physical health, nutritional health, and the sex education of our students. We are asking them to come and join our SHAC groups, which are on our Waco ISD website. And you can also find the immunization requirements, the clinic hours for the Family Health Center, and the Health Department on our Waco ISD website under the Student Health Service section.
Very good, very good. Well, Heather, thank you so much for joining us for Know Your Schools, and welcome to Waco ISD.
Thank you.
You're relatively new.
Yes.
Right?
6 months.
Very good, very good. And we look forward to visiting with you more, and best of luck, and remind those parents about immunizations.
Get your immunizations, no shots, no schools.
Very good. My name is Dale Caffey. This is Heather Branch, and we thank you for joining us for Know Your Schools on WISD TV.